The most commonly prescribed blood pressure medications deplete 3 nutrients from your body that your heart, kidneys, and brain need to function. Your doctor knows this. It is in the pharmacology literature. And there is a near-nil chance anyone told you when you received your prescription. Those 3 nutrients are magnesium, potassium, and coenzyme Q10. And when your levels drop, which they do within weeks of starting most antihypertensives, you start experiencing fatigue, cramps, brain fog, and heart palpitations that your doctor will likely attribute to something other than the medication. I am Dr. Michael Lee, and in over 30 years in integrative medicine, I have seen this pattern repeat itself thousands of times. A patient comes in on a blood pressure medication they have been taking for 5, 10, sometimes 20 years. They feel more tired than they did before they started. They have cramps at night. Their thinking is slower. And every time they mention any of this to their prescribing doctor, they were told to drink more water, eat more bananas before they started. They have cramps at night. Their thinking is slower. And every time they mention any of this to their prescribing doctor, they were told to drink more water, eat more bananas, or that it was simply their age. In the next 14, and at the end of this video, I am going to show you the number 1 mistake people make when they try to come off blood pressure medication on their own. It is a mistake that causes a rebound crisis that can send you directly to the emergency room. Stay until the end. Before we go any further, tell me in the comments, how long have you been on blood pressure medication? 1 year, 5 years, 10 years, or more? Just the number. Your answer genuinely changes what I am going to emphasize as we go through this, because the longer you have been on these medications, the more significant the depletion tends to be. Now let me explain what is actually happening inside your body when you take a blood pressure medication, because the mechanism is something your pharmacist understands and your prescribing doctor should explain, but almost never does. There are 4 main classes of blood pressure medications: ACE inhibitors, drugs ending in pril like lisinopril and ramipril; ARBs, drugs ending in sartan like losartan and valsartan; beta blockers, drugs ending in olol like metoprolol and atenolol; and diuretics, the water pills, most commonly hydrochlorothiazide and furosemide. Many patients over 60 are on 2 or 3 of these simultaneously. Each class works through a different mechanism, and each mechanism creates a different pattern of nutrient depletion. This is not a side effect in the traditional sense. It is a pharmacological consequence of how these drugs work at the cellular level. The depletions are predictable, measurable, and almost entirely ignored in standard follow-up care. Let me start with the most common and the most consequential. Diuretics, the water pills, are prescribed to lower blood pressure by making your kidneys excrete more fluid. Here is the problem. Your kidneys cannot selectively excrete only water. Every time you urinate a diuretic, you also excrete magnesium and potassium. These 2 minerals are lost in the urine at a rate proportional to how aggressively the diuretic is working. Magnesium is the mineral your body uses to regulate the electrical activity of your heart muscle, relax smooth muscle in your blood vessel walls, and produce cellular energy. When magnesium drops, your blood vessels cannot relax properly, which raises blood pressure. Your heart develops irregular rhythms. Your muscles cramp, especially at night when you are not moving and the depletion is most apparent. Your sleep quality deteriorates. And your blood pressure medication becomes progressively less effective because one of its primary mechanisms, vessel relaxation, requires magnesium to work. This is the deepest irony of long-term diuretic use. The medication depletes the mineral that the medication needs to function, which means over time, the dose needs to go up, which depletes more magnesium, which requires a higher dose. The cycle is self-perpetuating and almost no one catches it because magnesium is not included in a standard blood panel. If you experience leg cramps at night, particularly in the calves, write cramps in the comments right now. That is the single most consistent sign of magnesium depletion I see in patients on diuretics. It is almost never random. It is almost always the medication, Potassium depletion from diuretics creates a different but equally serious set of problems. Potassium regulates the fluid balance inside and outside your cells, supports nerve signal transmission, and keeps your heart rhythm stable. Low potassium, extreme fatigue, constipation, and in severe cases dangerous heart arrhythmias. Most doctors do monitor potassium because hypokalemia showed up on a standard panel, and because the cardiac risks are well known. But they monitor for it being dangerously low, not for it being suboptimally low, which is where most patients on long-term diuretics sit without anyone noticing. Now let me talk about the second depletion, the one that connects blood pressure medication directly to the cognitive symptoms I described at the beginning. Beta blockers and some ACE inhibitors deplete coenzyme Q10 through the same pathway I discussed in my video about statins. If you watched that video, this will be immediately familiar. CoQ10 is produced inside your cells through the mevalonate pathway, the same biological pathway that blood pressure medications of certain classes partially interfere with. CoQ10 is the molecule your cells use to generate energy inside the mitochondria. Your heart muscle is the most CoQ10-dependent tissue in your body because it never stops working and requires continuous high-level energy production. When CoQ10 drops, your heart becomes less efficient. You feel fatigued with less exertion than before. Your heart may develop a sensation of fluttering or irregularity. And your blood pressure may paradoxically become harder to control because a heart that is not producing energy efficiently compensates by increasing its output. The brain effects of CoQ10's depletion from blood pressure medication mirror what I described with statins: slower thinking, difficulty finding words, a persistent low-grade mental fog that you have probably attributed to aging. It is not aging. It is a measurable nutrient depletion with a measurable solution. Now I want to pause here and ask you something in the comments. I showed you 3 depletions: magnesium causing night cramps and vessel tension, potassium causing fatigue and muscle weakness, and CoQ10 causing heart inefficiency and brain fog. Which one of these matches something you have been experiencing since you started your medication? Write 1, 2, or 3 in the comments. I read every response, and this tells me what to cover in upcoming videos. Let me tell you what to do about it. I am going to give you 3 specific things, and then I am going to tell you how to have a productive conversation with your doctor about all of them, because none of this should be done without your doctor being aware. The first is magnesium supplementation. The form matters significantly. Magnesium oxide, the most common form in cheap supplements, is poorly absorbed and mostly excreted before it can be used. The forms with the best absorption and the best clinical evidence for cardiovascular support are magnesium glycinate and magnesium malate. Magnesium glycinate is the gentler option, less likely to cause loose stools, better tolerated in older adults. A typical therapeutic starting dose is 200 milligrams taken at night for 2 reasons. Magnesium has a mild relaxing effect that supports sleep, and nighttime is when your body does most of its cellular repair work and benefits most from adequate magnesium levels. Give it 3 to 4 weeks before evaluating. The first sign of improvement most patients report is that the nighttime leg cramps reduce or stop entirely within 2 weeks. Blood pressure improvements, when they occur, tend to appear at 3 to 4 weeks of consistent supplementation. 2016 meta-analysis in the European Journal of Clinical Nutrition found that magnesium supplementation produced a statistically significant reduction in both systolic and diastolic blood pressure in adults with hypertension, particularly those with documented low magnesium level. I want to be specific about this because potassium supplements are one of the few supplements that genuinely require medical supervision. If your kidneys are not functioning optimally, which is common, require medical supervision. If your kidneys are not functioning optimally, which is common in older adults on long-term blood pressure medication, excess potassium can accumulate to dangerous levels. Do not take potassium supplements without a blood test first. What you can with the highest potassium content per serving are not bananas, there is the most common misconception in this space. A medium banana has about 420 milligrams of potassium. A cup of cooked white beans. A medium banana has about 420 milligrams of potassium. A cup of cooked white beans has over 1,000 milligrams. 840 milligrams. Avocado, lentils, salmon, sweet potato, all significantly higher than bananas and all available without a prescription. If significantly higher than bananas and all available without a prescription. If your doctor told you to eat more banana for your potassium, ask them about white beans instead. The third is CoQ10 in ubiquinol form, the same recommendation I made in the statins video. 100 to 300 milligrams daily taken with a fatty meal for people on blood pressure medication plus statins, which describes a significant percentage of our viewers over 60. CoQ10 supplementation addresses the depletion from both medications simultaneously. It is one of the most cost-effective additions you can make to your health protocol. Take a photo of this screen right now. Magnesium glycinate 300 milligrams at night. Potassium through food, beans, potato, spinach, avocado. CoQ10, ubiquinol 100 to 300 milligrams with food. These are the three things worth discussing with your doctor at your next appointment. You do not need to understand the full mechanism. You just need to bring these names and ask for a conversation. Now, I told you at the beginning there is a mistake that sends people to the emergency room. And I need to tell you about it now, because it is the part that most YouTube videos skip entirely, because telling you to stop your medication gets views. But sending someone into a hypertensive crisis is not something I am willing to be responsible for. Here is what happens when you stop blood pressure medication suddenly. Your blood vessels have been under the influence of a vasodilating or volume-reducing medication for months or years. When that medication disappears overnight, your vascular system overcompensates. Blood pressure rebounds, often to levels significantly higher than before you started the medication. In patients with existing cardiovascular damage, narrowed arteries, or prior cardiac events, this rebound is not uncomfortable. It is dangerous. It can cause a hypertensive emergency, a stroke, or a heart attack. The right approach is a medically supervised reduction. This means discussing your desire to reduce your dose with your doctor, ideally armed with the 3 blood tests I am about to give you, and agreeing on a step-down schedule